Hey guys, so in this video we are going to go through the third section on viral infections of the circulatory and lymphatic systems. And so we are going to start off with um, mono, and it can progress to Burkitt's lymphoma, are caused by herpes. It is herpes 4, human herpes virus 4. I don't think we've talked about 3 yet. I know we talked about 1 and 2, but this is herpes virus 4, also called Epstein-Barr, and that can lead to mononucleosis. How do you get mono? It is typically spread through bodily fluids, mostly, but it can be spread through droplets, airborne as well, but very close contact needed for this. Symptoms of having mono, they start off with sore throat, pharyngitis, fever. Lymph nodes will be swollen. It can progress. When we learned in AP2, we talked about the immune system, and we said that the spleen is really helpful in your immune system, and the spleen can really swell up with this virus. So it may lead to enlargement of the spleen or the liver, which could lead to hospitalization because you don't want to rupture either one of those. That would be terrible. It's normally self-limiting. It usually causes extreme fatigue. It can cause other complications like the swollen spleen or jaundice, but usually it does self-limit. It is very common to get this virus. I think, what did the textbook say? Something like almost everybody. Yeah, pretty much almost everybody has had exposure to human herpes 4 at some point in your childhood. All of us have been exposed to this. These guys hang out in your B cells, in your B lymphocytes, and that's where they are going to potentially accumulate. And if you are immunosuppressed, if you already have a pre-existing condition like malaria or HIV, this Epstein-Barr virus can progress into Burkitt's lymphoma. So it's a malignant cancer, and it will grow into tumors like we see on this young patient here. And it can definitely affect young children that are infected with malaria and cause this rapid cancerous growth. So it needs to be regulated as best we can to prevent this from happening. Next virus is another one, human herpes, but this is number 5 instead of number 4. Everyone has been exposed pretty much to Epstein-Barr as a young person. Less of us have been exposed to cytomegalovirus, but cytomegalovirus has been in a majority of us. It mentions, I think the textbook said that half the people have been exposed to this by the time we are adults. So almost all of us have been exposed to Epstein-Barr, and then half of us have been exposed to cytomegalovirus, and that one can cause, instead of causing the Epstein-Barr version of mono, this can cause, cytomegalovirus causes the non-Epstein-Barr version of mononucleosis. It can also be similar symptoms: swollen throat, sore throat, swollen glands, fever, fatigue, general signs of malaise. With mono that this is associated with, it can occasionally progress just like with Epstein-Barr, and it can cause spleen and liver damage as well. Transmission for this one is similar to Epstein-Barr. It's going to be bodily fluids. Anything associated with bodily fluids, blood transfusions, organ donations. I think it said somewhere in the textbook that almost everyone that gets a kidney, if you're receiving a kidney, is going to be exposed to this if they weren't already. So kind of crazy. But that is cytomegalovirus, and how we know that somebody is infected is that you can stain, and we can see the owl's eye that is in this infected cell. That it looks like this, it does, it looks like an owl's eye when it is infected. This C of cytomegalovirus is also, because it is transferred by bodily fluids, mom can pass this to baby. When baby is nursing, mom can also pass this to baby in utero, and that could possibly lead to growth development effects of having this. So the C of cytomegalovirus is part of the TORCH screening, TORCH screening, that happens with pregnant moms out there. There is treatment for this one. There's a couple of different viral medications that are available to treat cytomegalovirus infections. Yellow fever. So we're moving on to arboviruses, viruses that are transmitted by bugs, by arthropods. So our first one is yellow fever. On all of these arboviruses, by the way, the best prevention is to prevent mosquitoes from happening. So the same thing that you're going to control mosquitoes with to try and control malaria and all of the other mosquito-borne diseases would affect these two. So control of mosquito populations were the best prevention for these next couple of diseases, because a lot of these don't have any sort of treatments. It's just care for the symptoms. So the first one is yellow fever, and we don't have this one in the US, but again, tropical areas where mosquitoes are prevalent are definitely going to have them. Sometimes people that are infected with yellow fever don't have any signs. They're asymptomatic, or they have mild illness, a low fever, but this can, fever and headache and chills, but it can progress. Some people will progress past that. They will have nausea, vomiting, constipation, and then some of them will develop worse and worse symptoms. A couple days later, they may develop these progressive symptoms. And some of them are going to be, as it progresses, if you were some of those unlucky people, if you know somebody that has this that has progressed, the progressive signs could be jaundice, which we see in this picture here, where you can see this patient's eyes are very, very much yellow, hence the yellow of yellow fever. So definitely jaundice, petechial rash, where it looks like somebody has spots broken out. These little capillary beds have broken out everywhere. Shows up. Very little urine is happening, and then this hemorrhaging begins to happen. So bloody vomit can happen from this. It can also lead to delirium, seizures, coma, organ failure, and death from yellow fever. And according to the textbook, it said yellow fever outbreaks were so bad that I think it said that it forced George Washington and a whole bunch of people out of Philadelphia because it was a really bad outbreak there. It mentioned that it affected Napoleon's army when they were here in the Americas, and that it was so bad to his army that decimated their army, and they decided to sell off the Louisiana Purchase to the Americas. In part because of yellow fever and how devastating it is. And it also mentioned that it affected the Panama Canal. If anybody knows the history of that, that was clearly affected by yellow fever and malaria. And being able to take over that project, when the Americas were able to take over that project from France, they were able to determine what the cause of it was. It is a virus, and it is spread by mosquitoes. So when you are able to control those, you're able to get a hold of these viruses. So this is yellow fever. Again, many people just have mild symptoms or no symptoms at all, but some people do progress, and it can lead to hemorrhaging and coma and death, the terrible things from yellow fever. Dengue fever, this guy over here, also going to be spread by mosquitoes. This one is normally self-limiting. It may have a fever and a headache. It may have a rash. It is called bone break fever because apparently it could progress and the pain can be so bad that it feels like your bones are breaking. So that sounds terrible. And then sometimes things get better and you feel like you're okay, and then it will come back in a couple days, and a couple days later it can progress to something called hemorrhagic fever or shock syndrome, DHF or DSS. And the hemorrhagic fever is similar to what we talked about before, where you were bleeding everywhere. You were vomiting blood. Blood is in your stool, and it can lead to shock syndrome where your vascular permeability, all your fluid is going outside of your blood vessels, your blood pressure drops, and that's going to lead to shock and organ failure. So this is dengue fever, breakbone fever, that is coming from the dengue virus that is spread by mosquitoes. This one, just like our previous yellow fever, we can try and treat the symptoms, but the best way to prevent it is to prevent mosquitoes. Our last arbovirus is, I'm going to slaughter this name, it's going to be terrible, chikungunya fever? Chikungunya? I hope I'm saying that right. CHIKV is the virus, and it is, again, spread by mosquitoes. It's going to cause fever, rash, blisters, joint pain, and this one lasts for months. They are usually self-limiting. This one is not typically fatal. So good news for that one. We don't have treatments for this one. It's just treating the symptoms, and vector control is our best way to stop this from happening. So these are our arboviruses: yellow fever, dengue fever, and chikungunya fever. All right, moving on to a different type of virus that affects circulatory and lymphatic, Ebola. So Ebola is when it is out, it is always in the news. So the latest outbreak in the textbook that it mentions was 2014. I want to say there was another outbreak since then. When the textbook was written, obviously this is spread by the Ebola virus that you can see over here. When the textbook was written, we were trying to treat the signs. We didn't have a whole lot of effective treatments for it at the time. How is Ebola spread? You contract this stuff by bodily fluids. You can also contract Ebola by handling fomites, PPE. If you're not wearing PPE, if you are in contact with, the bedding that somebody has been sick on, or towels or anything like that, that can spread Ebola too. So people that are not using proper PPE and handling patients are very likely to also come into contact and come down with Ebola virus. It affects healthcare workers often when these outbreaks happen. So once somebody is infected, most of us probably know that it at first sounds like any other disease. It's a fever, you got a headache. I mean, this is everything that we've talked about from all the other guys right before. Sore throat, headache and fever. And then later, it's going to progress to diarrhea, vomiting, and the hemorrhaging that Ebola is known for doesn't happen until 3 days later. So who knows how many people you've infected in those 3 days. that you've had this before the really scary stuff starts happening. Once that starts happening, mortality rate is not good for Ebola patients. It's typically 50%, if not up to 90%, depending on when that person came to get treatment. The sooner, the better on almost all of these things. The sooner you can get treatment for Ebola, the better. There are some different treatment options. One of them was remdesivir, which has made the news because it is a COVID treatment. It's one of our monoclonal COVID treatments. And they try to use it for Ebola, but I don't think the test results prove that it was statistically effective in its treatment. But now we have another treatment as of October 2020 that we do have another treatment drug. And it is Inmazab. Inmazab is the brand new drug that they just announced that they can use to treat. It's another monoclonal treatment to try and treat those that are affected with Ebola. And we also have a shiny new vaccine to prevent people from getting Ebola, and that one is called Ervebo. So healthcare workers that are now going down to places that are affected with Ebola can now take that vaccine, and hopefully they will be okay. And people that are potentially going to be exposed to that in the local areas can have that vaccine and hopefully be okay. So now, since this textbook has been written, we now have treatments and we now have vaccine for this. So that is great news. Hantavirus. Hantavirus is spread by rodents, really rodent pee and feces. And when that stuff dries up, when it's dry conditions in the environment, it aerosolizes it's disgusting, but it aerosolizes the feces. And then you breathe this in. And so if you have inhaled these, if you have handled these, and it's different rodents, it's a deer mouse, white-footed mouse, and a cotton rat are known to spread the hantavirus. It sounds like a flu, headache, fever, don't feel good, nausea, vomiting, diarrhea, and abdominal pain. Some patients will progress from this point and lead to pulmonary edema. And mortality rate at this point is 50%. It can also cause HFRS, hemorrhagic fever, and renal syndrome. We haven't had this in the US, but it has been seen in other countries, HFRS. And we do have treatment for that. And mortality rate is different with HFRS. The drug for HFRS is ribavirin for that one. We don't have treatment for the version that we have in the US. It's just supportive, treat the symptoms kind of stuff. So that is hantavirus. Watch out when you are handling rodents in dry conditions. You don't know if they've got this, and they have aerosolized potentially the feces that could spread that. All right, last but definitely not least is HIV, the human immunodeficiency virus. And so HIV, I'm sure we have talked about earlier in the semester. We talk about it in almost every class. Whether it's 1010 or anatomy and physiology, we always talk about HIV. HIV is spread through, again, bodily fluids, blood transfusion, sexual contact is how you get this. Mosquitoes are not going to transmit HIV to you, so it doesn't spread that way. There are now two different versions of HIV. There's HIV-1, that is, I guess, the OG, the original HIV, and then there's HIV-2, which is in West Africa. So if we look at this prevalence one, we can see that the biggest percentages are in West Central Africa, and then 71% in East and Southern Africa. So these are a huge chunk of the worldwide percentage are in these countries in Africa. And so HIV, I hope we know at this point that it attacks helper T cells, and that helper T cells are super important because they kick off your immune system, right? And they're going to bring in the other cytotoxic T cells that are going to activate the B cells that give you the antibodies. So if you don't have your helper Ts, it's a huge blow to the immune system. So how does it work? What does it do as far as signs? So it starts to infect those helper T cells. So here we've got our primary infection, and we're counting our helper T cells, and they're going to be in blue. Excuse me, in this picture. Oh my goodness. So here's our helper T cells, and they're in blue. So here's our primary infection, and our helper T cell numbers are way high. They're way up here. But as HIV starts to infect those helper Ts, it's going to start to take them out. So we see that the number gets lower. As this happens, we're going to start to show signs and symptoms too. So anywhere between 2 and 4 weeks, we're going to get this like flu-like illness that we may think is flu, but it's not. It's HIV. And so this is where your acute HIV syndrome kicks in. You are highly, highly contagious at this point. Look at the viral load, which is in red, how it spikes up there during this period. So super duper viral load is high and contagious, and then it's going to drop off. And if you thought you just had the flu, you're like, okay, I'm good to go, but you don't. So it drops off and it can go into latency. And depending on if you're treating this or not treating this, do you have access to the drugs? Can you afford the drugs? Because these drugs are super duper expensive. The sooner you treat this, the better, obviously. If you can get a hold of those antiviral drugs, they are going to hopefully extend that latent period. Those antiviral drugs have been shown to possibly extend the latent period for decades, which is great. And they do a combination of different techniques where it stops it from being able to reproduce. Another one stops it from being able to spread to new cells. So it's a drug combo that you would be taking to hopefully prevent this from growing and reproducing and tackling more cells to extend this latency period. At some point, assuming that you were not able to get the drugs, you were not able to get treatment, maybe you didn't even know that you had this because you were never diagnosed. But at some point, we can see the T cell number and look how low it's dropping. When it gets below 200, we are officially progress from HIV to acquired immunodeficiency syndrome into AIDS. And your T cell count's really low, which makes you super duper susceptible to other opportunistic diseases, all sorts of things that normally you would fight off, you can't fight off because your T cell number is so low because you have progressed to AIDS. So this is definitely stage 3 of an HIV infection, and it will lead to a fatal progression somehow at some point. So this is not a happy note to end this section on a fatal virus, but knowledge is power, and knowing how it's spread and how it's prevented so everyone can stay safe and do their best to not come into contact with this is best. So we have the table that has all of the different viral diseases in there all in one place. If you like the table, I always like the tables and suggest them for studying purposes because they chunk and put in the key things in there all in one place. So definitely check those out. And let me know if you have any questions. Thanks.